Good morning, everyone. Welcome to the Clackamas County Board of Commissioners policy session this morning. On April 10, 2024, County Administrator Gary Schmidt, please introduce the first item.
Thank you, Chair Smith. All commissioners are present today. Our clerk is at a training, so Everett Wild is sitting in as clerk to the board today. Thank you, Everett. Your first policy session is 2024 State Legislative Session Review. Our team from Public and Government Affairs, Tonya Holowetsky, Interim Director, and Trent Wilson, Interim Government Affairs Manager, will present. Go ahead, please.
Thank you, Gary. Good morning, Commissioners, Chair Smith. We are here today to share a summary of our state legislative work from the 2024 short session. We share these reports annually so you, the public, and county staff have a record of our work and can reference it for future sessions. Our summary reflects the board's state agenda approved in December, setting two objectives. Number one, achieve more funding for the courthouse replacement project. And number two, mitigate the effects of tolling while trying to advance the I-205 bottleneck project. In both cases, we were successful, and Trent will go into more details in just a moment. As you are aware, PGA works with every department to make sure every bill is reviewed. This year, there were 288 bills. The county tracked 180 of them that had the potential to impact county work or budget. Of those 180, we actively tracked about 20 bills. From a financial perspective, we were successful in delivering $19 million to Clackamas County, specifically to two projects, the courthouse and the 23-hour stabilization center. The county will also receive additional funding through programmatic funds, which are harder to calculate at this time. I'm proud of the work PGA did this year. We faced several internal hurdles, as you know, being interims, both of us, but we kept an eye on the county's goals and objectives, and I believe delivered a successful 2024 legislative session. And now I will pass it on to Trent to provide a few key details.
Thank you, Tonya, and good morning, Commissioners. Top of mind for me and what I want to share with you before we just make space for time for questions are the two county initiatives, and remember that we divide our work into the initiatives, those projects, but for Clackamas County, no one else would really advocate for. Priorities, where we have usually a lot of partners, and then also those principles, things that pop up that are just core or principal to Clackamas County. So I'm going to focus on those initiatives that are like very Clackamas-centric, and then make sure that we have plenty of time for questions for you. So again, top of mind are our two initiatives. For the courthouse, we started our session by working with the Oregon Judicial Department to confirm the number that we needed to request here in the short session, and we landed on $21 million, and that is the gap for the remaining state obligation for the courthouse. And we walked out of the session with $15 million. And so during session and leading up to it, we were hearing some initial concerns about what those dollars were going to specifically pay for, and we were hearing a little bit of concerns about really one of the pieces of the project, which is an off-site transportation project. And so while we are not firm or sure on why they chose $15 million instead of $21 million, which was our request, there's a $6 million gap there. We do have hints that it is related to that off-site transportation project, which is on Redland Road and 213, related to the courthouse, which is related to the permit to advance the courthouse. So we're going to work with Oregon City and the Oregon Judicial Department to figure out some nuances to that gap, as well as with the legislature. Nothing precludes the county from going back in 2025 to request the remainder of those funds for the state obligation. The next thing I want to cover is the I-205 priority within our legislative agenda, and we are counting this as a success, even though there was no actual bill in the 2024 legislative session. And here's why we feel like it's a success. I really want to focus on the Special Subcommittee on Transportation Planning, which is a carryover of our work from last year. So recall that we did a lot of work last year in many forums, including responding to the EA for ODOT. That was in late winter, early spring, which outlined a lot of our concerns about the project on the Abernathy Bridge. And that led to, we believe, the governor's decision in May to pause tolling, and it also led to the formation of the Special Subcommittee on Transportation Planning. And the reason that carried over into this year's work is because the Special Subcommittee on Transportation Planning was able to accomplish a goal of Clackamas County's that has not really occurred since 2017, which was to have public testimony to the state legislature on the topic of tolling for I-205. That had not really happened, or there had not really been a lot of opportunities to do that yet. And so in both December and January leading up to the session, they were able to host 4 public forums to testify about tolling. And the public showed up in good form, very huge attendance by the public to come and speak about their concerns or interest or topics around tolling and how it affects those communities. And what we saw was how that influenced legislators who sit on this special subcommittee. Before those public meetings, there were questions and curiosities by some of the legislators on that subcommittee. Some were a little bit closer to the work than others. But during the session, ODOT came to several of the subcommittee public hearings or work sessions to present on what they called deep dives into the tolling work. And what we saw was a pretty big transition or shift by those legislators who heard that public testimony and were able to answer questions during those deep dives that were reflective of those community concerns. And we largely believe that while no single act or work led to the governor's decision here recently to do a couple of things, but like that conversation, the public testimony, and the way that legislators are responding to those deep dives highlighted or reinforced some of the concerns that the public were having, that the county was having, our county partners were having with the toll projects in general. And that led to a decision by the governor the Monday after the session adjourned to shelve the regional mobility pricing project permanently, to delay the I-205 tolling project until after the 2025 session. And then the other part of that decision is that tolling will still continue for the I-5 bridge, the IVR, Interstate Bridge Replacement Project. That's a multi-billion-dollar project that will need every funding bucket it can get. But the delay for the Abernathy Bridge project was really to say there's still a funding gap here to fund that project. The 2025 legislature should come back and try to figure out how to fund it. Tolling is delayed but not off the table if we need to get back to it. So that was the governor's decision and direction to ODOT and to the OTC to make that move forward. And we've been working since then to clarify some lingering details, and we have those, and I'm happy to answer any questions on it. But what I really want to say about this is that all of that work culminated into what we feel is a successful outcome of our legislative agenda, which was to mitigate the impacts of tolling, find ways to advance the bottleneck project. And I would say as much work as we put into all of this up to this point, and we're at a place where I believe Clackamas County is very comfortable on this project, there's a lot more work to do to get ready for 2025. It's our impression that if there is not a funding solution presented in 2025 for the Abernathy Bridge, tolling is still part of the menu that ODOT or the legislature can pull from to fund projects moving forward. So a lot of work to do between now and I would say January to get ready for that next conversation. I just want to high level, cover 2 more things and then leave plenty of space for questions. The legislature focused a lot this year on the impacts of Measure 110. So I just want to flag that House Bill 4002 created a new misdemeanor for drug possession. That misdemeanor goes into effect, starts on September 1, and between now and then, local counties and agencies and public safety professionals can set up deflection programs in order to be able to help those who are caught with possession or arrested for possession go through a deflection program so they're not just going straight to jail. They have opportunities to move through treatment cycles. And so the county signed a letter of commitment to participate in the deflection program that was signed with both the DA and the sheriff and the county commission. And just this week, the grant opened up to be able to receive the initial swath of funds to start the work to create that deflection program. So we have until September 1 to get that ready to go, and then that will be in effect from September, on. So that's a quick update there. And then the last one, which is important to all counties in Oregon, which was House Bill 4056. That's the bill that counties tried to advance to respond to the Tyler versus Hennepin Supreme Court case last year that changed how we will do property tax foreclosure surplus sales. I think I got that combination of words correct. The bill that was introduced was very county forward and county specific. During the session, what we learned was there are a lot of interests and confusion about the work that counties do around foreclosures. And so there were a lot of amendments for that bill. It was passed in a way that counties had a little bit of consternation about. It still moves the issue forward, but really it was a tough one for legislators to wrap their heads around. and their arms around, and they created a task force that will do more work here in the summer, and there will probably be a new bill in 2025. So more work to do on it, but I know it's a priority for all counties, so I wanted to flag it for us today that it's not done yet. There's still plenty of things to do. So I'll pass it back to Tonya, and then happy to take any questions specific to any bill within the report.
Thanks, Trent. So as Trent said, and as you hear, the work never ends, the legislative work never ends, and we're already working toward the 2025 session, especially around the transportation topic that Trent spoke to you about. And we'll start again in earnest around August and September, working again with you and all the departments to begin preparing for the 2025 legislative agenda, and of course, seeking your approval just ahead of the session. In closing, I do want to thank all our partners across all county departments. Our success comes from the excellent partnership and coordination and the work with the various staff across the county. And every department plays a role, and this is a full county process, and I want to recognize that. I also want to recognize the 2 contract lobbyists who support our high priority projects, so I want to thank Phil and Ryan as well. And then I want to give a really big shout out and recognition to Trent, who stepped into the manager role just as we were moving into the legislative session, and I think you did an amazing job. And then I want to also thank Administrator Schmidt for your guidance and support throughout the process. So thank you also, commissioners, and Trent and I are now happy to answer any questions.
Thank you. I have a couple questions I'm sure all of us do. You said that the governor permanently stopped mobility pricing projects. Is that correct? Did I hear you say that?
So I'm not looking directly at the letter, but yes, the RMPP project was shelved. And so ODOT is
And for
archiving that
people
information.
listening out there, will you explain what that is?
So there have been, House Bill 2017 told ODOT, invited ODOT to go and study tolling. And then in 2021, House Bill 3055 passed, and that put parameters around it. And what ODOT's takeaway from that was, we got to find a way to fund mega projects. And so they targeted the I-205 bottleneck project as one of those. But House Bill 2017 said, look into funding I-205 and I-5 from the Willamette River in Wilsonville, Boone Bridge, up to the Columbia River on those two things. So ODOT was investigating or looking into tolling that full corridor with what's called congestion pricing. It used to be called value pricing at the time. So it's basically flexible pricing based on when congestion is. The price can go up or down with the intent of limiting congestion or changing travel patterns to move congestion around.
So during the peak travel hours, they would be charged the most money?
There was never, yes, that would be the intent, but there was never like a firm detail on what it would actually look like.
Well, you hear the term congestion pricing, and that would lead one to believe that's what it is, although they haven't come out with a definition on it. Thanks a lot. Let's go back to Measure 110, and you mentioned that Clackamas County signed a letter of commitment on that with the DA and the sheriff, and we called special ops. Martha Schrader and I sat on that. So I want to talk about, we gave our support contingent upon funding to fund this. And in your opening, you didn't tell us how much money we're going to get for this very important program. How much money are we going to get to implement the deflection program and the new bill regarding Measure 110?
There are 2 buckets of funding to support this work. One of those buckets will go towards specifically the deflection program. It's an impacts grant, and the county's portion of that fund will be, it's not going to sound like a lot of money, but some caveat to it. The county's portion of that funding will be in total just shy of $1 million. Here's the caveat, is it's intended to support work from September 1 of this year until basically July 30 of next year, because we're within the state budget biennium, so the state will need to continue to reauthorize those fundings at different periods. So it's, I think, about 5% of the amount of funds that the state produced for this work, and that is for all counties to do it. For those counties that don't participate, that number could potentially grow if there are counties that don't, go and accept those funds. So it's about $1 million estimated to come to Clackamas County to set up that program. That number, in my memory, was set up based on how counties who do lead programs for mental health and housing are set up, and there are 2 counties that do that. Clackamas County is one of them, Marion County is the other. And so based on those projects and the work that those folks do, there were estimates based on that, and the Clackamas County spends about $1 million, just a little over $1 million to implement that LEAD program. So they were looking at sort of match-to-match type, funding opportunities, and that's what our DA was advocating for. Is like, if you're modeling it after that, that's how we can set it up. And so similar pricing to do that work, at least for from September until the end of the biennium, and then the state will need to continue to re-up that at a more proportional rate. I'll also add, the county can set up its own program. This is not a state mandated program with prescriptions. It's a local specific program specific to what we have capacity for and availability for. So if the state gives us $1 million, we can set up a $1 million program. If they give us $2 million, we can set up a $2 million program. So that'll be the work that the DA and our law enforcement team in the county behavioral health office will be working on over the next couple of months. There is another bucket of funds that number is a little less, it's a little more ambiguous. It'll be a formula fund to the behavioral health office to coordinate with the Burns behavioral health resource networks. Those are basically nonprofit providers that also support addictions wraparound care. So that will put the behavioral health office in a position to coordinate with the DA and make also coordination with those agencies that are participating in those burn programs.
Okay, that's our behavioral health office. We'll be coordinating with the DA. How much money is that?
So that's a number that I have not seen directly yet, so that's where I don't know the
Well,
answer
there were
to
some
it.
numbers floating around, and the district attorney was able to give me a number. He gave me a number, Trent.
For the burn program.
Yes.
Okay, I'll look it up.
We signed that contingent upon receiving financing, and that is uber important. And I would suggest that's your first charge. If you want any legislative work to do, is you make sure it's funded. And you go back to our statement, subject to financing. It's nice that they're taking advantage of our LEAD program at the 2 counties, and I'm somewhat honored that they're looking at that as a state model. But they need to fund it. They need to fund it, and that really needs to be a priority with that. I think that's all the questions I have now. Commissioner Savas, you're up.
Yeah, well, while we're still on the 110 thing, I think that as I take my comments and move into the transportation side, I want to say the 2 things that are similar with both of these are that the funding and the remaining infrastructure, if you want to call it that, is uncertain. And I guess our letter didn't say full funding, it just said funding. And so therefore, my guess is, not unlike a lot of other things, it'll be a patchwork of funding probably that builds the infrastructure. There's a programming aspect of 110 through the DA's office and others, and there's also standing up the treatment aspect, which is our next session following. So all to say that these aren't complete answers, they're not complete solutions, there are steps in going forward. And I think that's going to require continual efforts and looking for funding from all different directions, which means partnerships and cooperation in order to be successful in that. So with that theme, as I move into the transportation side, there's been, just in the last week, there's been 3 meetings that I participated in which state officials were ever present or leading discussions, and it's not really clear. I know that Trent staff, our transportation team, have done outstanding work. I thank you for all the great work you've done. I think this is a series of battles. We might be winning here and there, but there's still a long road. And, when I hear whether it's the governor or the head of ODOT or other key staff say things, sometimes they're not really congruent. And I'm not being critical of them other than to say I don't think they know either. Everything is contingent upon trying to, number one, make sure the funding for the Abernathy Bridge is there to complete it. What's come out of this is that there's a funding crisis just on the maintenance side for not just ODOT, but ODOT's done a better job of getting that message out than the counties and the cities have. But There's also been some language, words used, some in writing, most verbal, but some in writing, in which our 30 cents or our 30%, 50-30-20 split could be in jeopardy because ODOT feels that they've got this funding crisis, and why should we share that with the counties and cities? So that raises alarm bells, which tells me we've got a problem, a challenge. We've heard language would suggest what you were getting clarification from Trent on with the RMPP is forever dead. I hear things that, it's like if we can't find a way to fund it, I think all those things will be revived and come back. So to fight another day, I guess. So I'm concerned about that. The variable pricing aspect of RMPP, congestion pricing, to the chair's questioning, is real, but don't forget that the variable pricing on the Abernathy Bridge, not RMPP, was also variable pricing based on congestion. So the busier it is, the more that would cost. So that was built in. So that's almost a presumption, and I'm sure that on the I-5 bridge, there'll be something quite similar to that on the I-5 bridge. So I think it's every upper state official on transportation, including the governor, have made statements that tolling is still here. It's still going to be what it looks like. We don't know. But the bigger picture, we've led the charge. I think Clackamas County has been, not say just the county, but our jurisdictions in the county have been very active and very successful in making the case of why tolling this particular section of I-205 is not a good idea. What got muddied in all of this is that there is not a lot of attention to the diversion we're experiencing today, though we've made it to some. The diversion we're experiencing today because of the bottleneck, which is really the goal for the county, is the I-205 improvements project, all of it, both of it. That phase 2 is about $745 million is what they're estimating right now, and no funding in sight for that. Now, they can patch funding, I heard, to complete the Abernathy Bridge, but I think it's a responsibility for the state and the counties and cities to step into that discussion. We've been at the forefront of trying to get that initiated, a funding discussion, starting well before, or last year, well over a year ago. And we're hoping to be involved in that, including on Monday at the CHAIRS Act modal meeting in Kaiser that I attended, the AOC meeting on Monday, and the R1 Act meeting, or not on Monday, but on Friday, and then the R1 Act meeting on not this Monday, but the Monday before. So that funding discussion is going to include everything under the sun. And I think we need to be part of that. And maybe that's a discussion for another day, but I just want to say that I think it would be, if Clackamas County didn't help in that conversation, we would be missing an opportunity. And I think that we have, at least I think the respect and standing that I think there's an expectation that we should or could, would be involved in those discussions. So I just want to say that it was a short session, and there weren't 1,000 bills, but a few hundred, and I think we did pretty good considering. And I think all the work and focus was on the 110. I think a lot of the focus will be for the 2020 session on transportation funding, and that starts now. And I hope that we have an opportunity or a table to be involved in that. But we will need to ask for guidance as to how that take shape and what we can proffer to give the state or our staff. What do we support in order to get the I-205 improvements project or the bottleneck fixed? I think we still have a lot of legwork to do to make sure that other legislators are aware that the diversion problem is not over, because diversion is now maybe on the shelf. The diversion problem is still here every day, every weekday, Monday through Friday, and we got to be mindful of that. And I don't think, though we made that case, again, I'll just say that we need to continue to make that case that the problem's not gone. That's why the I-205 bottleneck project is on the table in the first place.
Commissioner Savas, you make really good points. Commissioner Savas, you make really good points. because now they're talking about tolling 217 and Highway 26. So then where's the diversion? I-205 becomes their diversion, seriously. I mean, if they're going to take that out, people aren't going to run round down 217, they're going to take another route. And so because of the lack of transportation projects in this state for the last 35 years, you can't take an action on one without it affecting the entire Tri-County region. Thank you for your comments. Commissioner Scholl, you're up.
Thank you. Good morning, Trent and Tanya. Today, personal debt in the county and credit card debt is at an all-time high. The idea to increase taxation to pay for highway projects is a no-go. With a $121.7 billion biennium budget in the state, and quite a sizable chunk of that going to ODOT, we still can't pay for the infrastructure we need. So many people are asking, how can Clackamas County, our legislative staff, and the Clackamas Coalition light a fuse to compel the audit of ODOT, its expenditures of state and federal money, to include how it is utilizing funding from House Bill 2017. You know, we know that it's potential that in the coming years, federal money might get more difficult to get grants coming to our state. We need to recognize that we have to utilize what we have available to make things work. And many people in the state, many people in the county are saying they don't believe that the huge amount of money that our state is collecting from its citizens is being used in an appropriate manner. So I ask you this question, just a question for consideration in the next coming weeks. Would it be possible for us to take action to begin to compel the ODOT, audit of ODOT and get it done before the 2025 legislature convenes, so that they can go into that legislature session with a new understanding of where the money is? I just feel this is important. One more thing I want to share with you, and that is I realized in the short session the idea to raise the threshold, the tax level on the corporate activity tax, it failed. So it's still at $1 million of gross receipts. And that, if there's a tax in the state right now that's getting a huge amount of resentment, it's a corporate activity tax. The cat tax, as it is known, needs to be thrown out with the used kitty litter. Yes, it does. And so I present these things to you today because, you know, like we've done in the past on tolling, some of the folks in this room lit the fuse to resist that tolling. I believe that now is the time for us to light a fuse on the audit of ODOT so that everybody can clearly see where the money is, and then we, the people, can have a chance to look at how we might want that prioritized. Thank you.
Thank you, Commissioner Scholl. Commissioner West, you're up.
Morning. Start with Measure 110. A great job on the $4 million for the 23-hour stabilization. We talked a lot about this, Trent. It was shovel-ready, ready to go. It met an immediate need within a care continuum. Fantastic job. That's a good chunk of money for that. I think that maybe frees up some other dollars for us to do some other significant things. So we almost kind of, I feel like we kind of doubled our money in a way because we already had some set aside, and this allows us to free up other resources to deal with this issue. So this is really a smart and sensible ask. Great job. Not a small thing, because not everybody got some. So good job. State, $16 million statewide community corrections program is pretty fantastic. Can you talk a little bit about the 7.5 million statewide support for aid and assist programming? As that has been really a consternation, not just with Clackamas County. I know Marion County has been really diving into this issue with, people who really still need to have some level of treatment and support are really released too early into the community, and it's not good for the community, it's not good for the person being released, right? But we have 7.5 million. I would like a little bit of an explanation or a synopsis on what that 7.5 million is going to do to help us in that issue, as I know we're not done dealing with it, but this funding source specifically.
Thank you, Commissioner. This is, as you know, a massive topic to cover, the issues with aid and assist and liabilities related to it, and how the counties receive responsibility, contractual responsibility to care for individuals that were sent to the state hospital from the DA with this aid and assist designation. So when they come out of the state hospital, they are no longer wards of the state, they're wards of the county behavioral health program. And there have been liability issues related to that, actually some court cases in other counties. I don't think that we have any active, but I'm not the county council, don't quote me on that, but I've not heard that recently. So there are major liability concerns with being able to execute these contracts, and because the state hospital continues to be at capacity, continue to release clients in that regard, the counties wanted more capacity and ability to serve these individuals, barring any additional changes from the liability threshold. And so there was a work group last year that negotiated some of these opportunities. They reached this funding number to say, like, this is a way to keep this issue moving forward and keep having a negotiation or a contract about it. But to do the work, we need more funding to be at capacity to serve these individuals in a way that, helps us reach an expectation and perhaps reduces the liability because we'll have adequate services. So this number is statewide. It'll go to the behavioral health programs at a formula rate. That's what these dollars will try
So
to do.
7.5 million is statewide for aid and assist.
That's correct.
Wow.
Wait, is it? Help me.
Come forward, Mary, please.
Come on up, Mary, and you don't get a refrigerator.
I promise no refrigerator.
All right.
Good morning, Mary Rumbaugh, Behavioral Health Division Director. So that 7.5 actually is going specifically to 6 community mental health programs, Clackamas being one of them.
Okay.
Those of us who have the highest numbers, although currently the number of people at state hospital for us are at our lowest, which is 14. So it will be a pilot, which is always a little bit like a head scratcher, and it will be a community navigation model. It will be a case manager with a recovery peer who will be focused solely on assisting from the get-go those individuals who are at the state hospital. So once we assign that individual to this 2-person team, we will see them through once they're discharged, all the way through community restoration. So it was a way to address the continued challenges at the state hospital by dedicating funding to a 2-person team who will solely be focused on those folks who are at the state hospital. It is a pilot. We have not seen the agreement has not come to you because it's still in a draft form at the state, but that was the intention. So it's about $1 million. The dollars will only, it's really once the contract is executed until June 2025, but any unused dollars will be able to carry forward beyond 7-1. So it will be a pilot. That always makes me a little bit nervous, but we'll see if the pilot, it will be lots of outcomes to monitor to see if it can be successful and then go to, a request for future funding.
And I remember we talked about this during the short session, I think, briefly at the center after one of the meetings I was at with you. We had a brief conversation. Here's my concern, and help me understand if this is really a tool that we think is going to be impactful enough. This has really been a big county issue and public safety issue even. There's stories in Marion County where someone is supposedly deemed ready to be released. They clearly are not stable. They are not safe for themselves or for those in the community. They commit an additional violent crime or act as they are released back into the community. But, aid and assist is to say, hey, are you able to begin to stand trial for yourself, the bare minimum threshold to be able to, go through the due process that we're all afforded. But a ruling made it if it's taking longer than a certain period of time, you just have to release them. And so we've had violent crime, really horrific violent crimes happen by people being released that, and I would believe personally and clinically that it was not appropriate for them to be released. Having somebody released into our county in this situation with a peer review support outpatient model chasing them around the county with a very, very limited source of funds that goes throughout the entire state. Is this one of those I want to know really the outcomes of the impact of this. I know you do too, Mary, and I know we all do. But I'm concerned that the state is not giving that local support still for aid and assist to counties. And this seems to me almost a bare minimum, or to look like we're doing something in name, but we really haven't quite done that, what we need to do to address this problem. We prioritize public safety here, our numbers show that. It's a big deal for us. And I want to also, but this is not just safety for those in the community, it's safety for the person that's in this situation also. What are your thoughts about how you think this is going to roll out? Is this an effective intervention? What kind of burden does this put on you administratively? Because you're tasked with this, Mary. You got a big job already. So, and it's not permanent, right? So I don't know if it's a real fix, a Band-Aid, a little Band-Aid on a big cut. What do you think? What are we getting into here with this?
Well, for full transparency, I was an initial no. I was concerned, pilot, can I even hire people fast enough? But in talking with my aid and assist team, they said, right now it's a small Band-Aid on a big problem. They said any additional resource, I hate to turn it away, knowing that there's going to be new and additional reporting requirements that are going to fall to them. So, and my colleagues, especially the other two counties, were in the same boat, but we all did come to the conclusion. So all 6 community mental health programs did agree to do the pilot because, again, we hate to turn away the resources. So I think we're doing a little bit of fingers crossed that maybe we'll see some good outcomes. The challenge is there is a caseload limit to this 2-person team for the entire period, 15 people. Now I've got 14 people. Right now at the state hospital, I'm okay. You're Multnomah County and you've got 50 to 70 people at any given time. 15 people is a drop in the bucket.
Yeah.
So I actually think we could see some good outcomes. I do not believe that will be true for Washington, Marion, and Multnomah County, who have the largest
We all
numbers.
share a border with.
Yes, exactly.
I think I'd like us to still begin to advocate for meaningful legislation that truly addresses the local level around aid assist. I think we have a long ways to go there. I think that we're not the only county that has immense concern around this. This maybe is a little win-ish, possibly, I don't know, or a push, but this is a big problem we got to deal with. And then I'll move on, and this might apply. It says expedited funds for the deflection program to respond to the addiction crisis. We've had these conversations behind the scenes. I'm still not totally clear on what deflection means. I know they're off-ramps to avoid the justice system. This is kind of novel. It sounds like the big compromise with local governments, DAs, and sheriffs saying, fine, we'll play your deflection game. I honestly can still look, outside my window and see a crisis that I think that this may help, may actually, like optimistically, trust but verify may help. I think we have a long ways to go to dig out of the hole that we're in, a long ways. And I'm excited to start the conversation, I think tomorrow or later this week with Lipstick about how we're going to start creating. I believe you're going to be there. Both of you, I think, are going to be there. I think we'll be well-staffed and figure this out and roll up our sleeves. But I'm still kind of concerned about what deflection looks like, what that funding source is exactly. I think you've heard all of us commissioners say that. There's a lot of off-ramps before you ever get to real any accountability. And we even get to potentially the 180-day misdemeanor, the unclassified misdemeanor. I know that our DAs and sheriff's officers are optimistic and made this compromise. I'm in support of that. I am concerned also that this still potentially could not get us there, and we're still prolonging the inevitable to actually pass good public policy. I'm excited about that conversation going forward. Overall, there's a few things in here I really like that we got out of the Clackamas County. There's a few things I have a little bit of indigestion over. I think we share those sentiments, so thank you for that. I'm going to piggyback a little bit on Commissioner Savis's transportation comments. Sorry I'm taking so long, but, yeah, thank you, Mary. On the transportation comments is, somebody really wise told me once, when I started jumping into some public service and public policy work is, you can be against a lot of things, but eventually you have to have a plan on what you're for. I don't totally know what we're for. I know we're against tolling, but at Clackamas County, I'm not clear what we're for. Now, we've been a leading voice. We've galvanized 16 cities. We are a player in this space. And I think that next step for us is, what the hell are we for? And what is the creative ideas that we can come together and broadly kind of talk about and support if we hate tolling? And maybe it's a lot of different things. Maybe it's a smorgasbord. Maybe it's more input from our communities. I hope that we can continue right now to utilize this time right before the session to talk to the 16 cities and ask them, maybe if you see for other method, what are we for? What is now the plan? What can we get on board with? Because we were super effective as a giant unit and allies. I think you would agree. You kind of alluded to that, Trent. I want to see that continue. I think maybe some of that work moving forward as a Board of County Commissioners is the tough conversation about what are we potentially open to. Now, it is the legislature's decision, right? But we can offer up a couple, let's have amicable conversations in this sphere, but it's the decision of the legislature. So I don't know what you think about that. That's part of the plan.
Thank you for alluding to that, and you said something similar to what I like to say, which is try to come to the policy quilt with patches, not a knife. And I give that recommendation every once in a while to come with ideas, right? Try to come with solutions. So thank you for that. So on the transportation, let's call it the path to the transportation package. We have some local work, there's regional work, and then there's statewide work. So we are working right now with the Department of Transportation and Development, and C4 is also talking about this too, which brings the board into this conversation as well. We're moving towards right now the C4 retreat on June 14 and 15, where we will be working with all those partners you just mentioned, and one of those days will be dedicated to how do we get to the 2025 transportation package. And to your point, one of the lingering questions is, if not tolling, then what? Or what can we be for? How can we be for something? And that might be a policy level question. We're for operations and maintenance solutions. We're for the bottleneck projects. We may not need to specifically be a funding mechanism, but we need to have that conversation as a group to find out that very question you're talking about, and that'll be an opportunity to talk about it in earnest and hopefully come out of that retreat with some values and outcomes, some priorities or philosophies as a group to keep moving forward. So that's in June. In July, the JPACT, which Commissioner Savis sits on, will start talking about sort of their initial desires for regional priorities. And then in September, the Joint Committee on Transportation will start to have their, we'll call it a straw dog, a draft of what they want the 2025 transportation package to look like. And in the meantime, the Joint Committee on Transportation between May and September will be doing a road show to different communities to have that same question. And so we're setting up now these opportunities to talk locally, including at the retreat, but we can have those conversations here with the board too, if you wish, on how to have those foundational local priorities for that very topic. And then that will give all of you the ability to move towards that regional conversation in July. And it'll go longer than that, but it'll start in July. And then it's opportunities in September, November, and getting closer to the session to build up towards the bigger conversation. But that'll give us an anchor in those conversations if we can have those conversations sooner. So we're thinking about that. There's a few milestones where we all get to participate at the local level. And then hopefully what we'll do is take your direction from those moments to then, wedge into the bigger conversations.
So if transparency in government's a big deal, Commissioner Scholl alluded to this with an audit. It can be kind of buzzy. However, we have a Secretary of State that can do an audit. The legislature can do an audit. The chief auditor is the Secretary of State that could take that agency and really put some sunlight on it. I think a lot of people are questioning all across the political spectrum in Clackamas County, that's a giant, but where's that money going? And now you want to take more that we don't have. Is it uncommon for us to lobby or approach the Secretary of State to do that audit? Is that a way for us to go? We're going into an election cycle. We're going to have a new Secretary of State. Is there a way for us to be strategic through PGA or through other entities, the 16 cities, to say, in a very responsible, pragmatic way, transparency in government, We would hope that the Secretary of State would consider doing an audit on ODOT itself, because it is the chief function to be accountable, right? I don't know. I'm just throwing an idea out there. I think I'm not the only one saying that. I know I've heard other senators and legislators bring this idea up, county commissioners, local electeds. We can't be the chief one out there. We're one county, maybe AOC, but I'm trying to figure out how do we put this also on our radar, have ideas, transparency and accountability, I think is a good point that Commissioner Scholl made.
Finished? Okay, before I call on Commissioner Schrader, regarding this conversation, I have been talking in my chairs and mayor's meeting every month, and I will be consistent on this going forward. It is not up to the city or a county to tell ODOT where to get the money. Okay? And until four things can happen. And I think you're going to find that I've been presenting this to the mayors, and they're pretty much in agreement. Legislative oversight of ODOT funding. ODOT gets larger pots of money in state gas tax and federal gas tax, and nobody knows where it goes. Number two, audit ODOT current expenditures and eliminate unfilled vacancies just as a start. Now, I don't think the Secretary of State is equipped to do a full financial audit, Ben, but I don't know. But there is opportunities out there for that. And the third thing that is so important, and the governor alluded to this in my private conversations with her, eliminate the silos within ODOT, because this department and ODOT isn't talking to this department, isn't talking to this department, and they're certainly not communicating with the governor on this. So until we do a deep dive into that department, I'm going to tell you, there's not very few citizens in this county are going to support our efforts to raise new revenue, because raising new revenue is increased fees, it's increased gas tax, it's increased this and this and this, and there is not the appetite to do that until we can do a deep dive on that. And I would hope Commissioner Savas and I would hope Commissioner Scholl, when you're attending your transportation meetings, you mention these three things. Legislative oversight on ODOT funding, because we can be beating the drum from now until 6 years from now. It's not going to do us any good. Audit ODOT. They have to change their business practices, their way of doing business. That I was in the legislature in 2001, and they're still doing the same thing with very little results, and eliminate the silos. And that's just a start. So just want to say that. Commissioner Schrader, and then I'll have a closing remark.
Well, one of the things I've been working on that keeps coming up, and actually all the forums, particularly with the business community at this point in our workforce folks, is the child care issue. I know that hasn't been a priority of the entire commission, but it has been a priority for me. Would you be able to speak just to a few of the things that happened this legislation session with that? When I visit the chambers, it's an issue. When I go to our workforce board, it's a huge issue. We've already mapped childcare deserts in this county, and we're trying to increase the capacity. So just a quick thumbnail, Trent, can you tell me what happened this go-around in the legislature? I think I know. I have a few things here that I particularly tracked and did get funded, but I thought you might just speak to that a little bit.
Thank you, Commissioner.
And I know it's not in the report, but you all know it's something I've been really deeply interested in because of the ability of people to get to work and have jobs and be able to support their families. So.
Yes, thank you. Very quickly, there is a coalition that tracks all of this, and I'm happy to share that with the board so that you have that full information of what did and didn't happen, which is a better summary than what I can provide, and so we can share that with you
and
shortly afterwards.
You did send that to me, by the way. I have that, I think,
Great.
in one
And
of
I'm
my
happy to send it
packets.
to the whole board for those interested.
Yeah.
I'd say the big takeaway was this bill that was able to take the CHIPS funding, the semiconductor funding, and require that if there is a major manufacturing or construction of a unit, that the CHIPS funding is eligible to be used for childcare for the folks who are in the construction site. So it creates a childcare opportunity to incentivize people who are able to then work for and advance that project. It's specific to that money, it's specific to that industry, but that is, I think, a big win for infusing a lot of dollars and helping it move quickly and try to incentivize people to be able to work on it and be available for labor. That was, I would say, where the bulk of the work existed. And then a lot of the other pieces are trying to find funding for the child care deserts, trying to find ways to incentivize movement towards building new facilities or incentivizing the industry and create workforce pathways into that industry. And then right now I can say there's a survey open on the Department of Land and Conservation Development, DLCD, on their website to ask if there are any hurdles or pathways to try to build more child care facilities. So that's an active survey right now that, you know, planners and other folks can participate in to maybe get ready for the next conversation on child care.
Okay, well, just for everyone's information, what I have here, they did pass employment-related daycare at $99 million, and that is helping low-income families actually get child care so that, again, they can get to work and have a job. They did partially fund the CHIPS and child care at $5 million. That happened because the federal government, I believe, with the CHIPS Act, put a rule requirement that child care had to be childcare was a big issue, and that if they were going to give the money for the expansion of chip factories, they wanted to see daycares part of that package. They funded early intervention, early childhood special education. And then the one thing that you just mentioned that didn't get funded was the structural piece. That is there money to actually even just get the sticks and bricks to make sure there are locations? And I know that folks have been extremely interested in that. I know that I've worked with KinderCare. They were looking at that bill very, very closely. And I'm hopeful that that will come back next go-around. And as you said, the LCDC model of looking at what those barriers are with land use, but also taking a look at what the requirements are to have a functional daycare internally. I mean, the expense has to do with having small enough toilets, sinks at an appropriate level, space for outdoor recreation, indoor recreation. There's a whole plethora of things that have to be met before you can really meet the threshold of being a safe and secure child care facility. So that's something else that we've been working on under that rubric. Okay, thanks.
Thank you.
Thank you, Commissioner Schrader. In closing, I want to say I'm very grateful for the hard work you did, and by any measure, this session, very short session, was a huge success. You know, you've heard us all here express our frustrations, but we're happy. Seriously, it may not come across. I know I'm very happy with the results, but the human condition is always to strive for more. I guess we're very human in that regard, and I think you know what we want to look at. I would encourage the commissioners here that as we go through the end of this spring and into summer, we identify areas that what we would like to do in the legislature and what that looks like. I know I have a really big ask to present to the board, and that'll happen next fall. And I'm very excited to work on it. But just keep that in mind, what you'd like to see happen, and then we'll meet in September and we'll go over the list. How's that sound?
Perfect.
Thank you.
Great, and thank you again, and thank our contract lobbyists out there who have helped us get here too.
Excellent.
All right, thank you very much. Gary, what's next?
Thank you. Actually, I'd like to thank you, commissioners. All of you either emailed or called legislators, and you also went to testify in Salem. So thank you for your advocacy to help with this agenda. Next policy session is Recovery-Oriented Service Center Data Update. This is what you've been asking for, commissioners. We're ready to share this with you. Cindy Becker from County Administration will be the lead presenter, and Mary's in the room should you have questions for her. Go ahead, please, Cindy.
Mary's in the room.
Mary, you can come up. It'll just save you a trip.
Come on up, Mary. Mary Rumbaugh from Health, Housing, Human Services.
Cindy, we got the good Cindy here, too.
Back a little. Mary's triple booked, I think, so.
That's all right. It's all right.
Good morning, Commissioners. I'm very glad to be making this presentation to you this morning. I want to take you back a year ago in April of 2023 when you passed a resolution to guide county actions about individuals living with substance abuse or mental illness who are houseless. The resolution you passed said, now therefore be resolved by the Board of Clackamas County that all efforts to address homelessness in which the county and its employees engage must be concentrated on helping all residents participate in realizing their full human potential by ensuring shelter, psychiatric, behavioral health, and addiction care for all who need it, and by protecting public spaces for the use of the entire community. You know this, you remember it, but for the public who's watching, I think it's really important to provide this backdrop and this context. After you passed that resolution, you also initiated an Addictions Recovery Summit last fall, where we brought people in from actually around the country and from Canada. And there's some quotes here. I'm not going to review the whole summit, but I think there are some quotes from the panelists here, who some of whom are in recovery and who have significant experience in the substance use disorder space. One of the things that our panelists from Texas said, the answer isn't housing or services, it's housing and services. Another person said, another doctor, people are searching out fentanyl. The medical interventions we thought were good today are useless. We're learning from pockets of excellence. Another one, almost done. Most addicts will tell you they wish someone had intervened earlier. And last but not least, this is from the president of Central City Concern, Andrew Mendenhall. We have people waiting. Substance use disorder is a condition where if people wait, people die. And even if they don't die immediately, people who don't get help when they are ready for it may no longer be ready when the help finally does arrive. That and the resolution you passed really sets the backdrop for your initiative, your direction to staff to get moving and get moving around a recovery system of care, and more specifically, get moving to develop a recovery-oriented center. And that's what this session is about. We started working on this actually after last fall. And today's session is to give you an update on to where we are, to answer your questions, to talk about what's next. And I also am going to ask for your approval for a NOFO. You probably don't even know what that is, but it's a notice of funding approval, and I'll get to that in a minute. So again, we've been working with providers, with peers, we've met with public safety, and been meeting with a lot of different people. We've met with HealthShare, a coordinated care organization, Trillium. We've spent these last several months really gathering information. And I have to tell you that gathering information specifically on substance use disorders is no easy task because of the federal and state, mostly federal hurdles around getting specific information. You're not even allowed, if Commissioner West called up, I was a provider, and said, is Mary in treatment? I couldn't even tell him whether she's here, whether she's in treatment, or anything. You cannot divulge any information. It's much stricter than HIPAA. And so getting this specific information is a challenge, but I think we've done a good job in getting what's available. So what I want to come back to you again is what we're looking at again, is setting the stage and the foundation. And this, we've talked about this with you, and you've agreed with this. The vision is that Clackamas County envisions recovery for all individuals struggling with substance use. That's really, that's key, that's foundational. And the mission of the Recovery-Oriented Center is to ensure that individuals struggling with substance use receive timely, person-centered support, treatment, and resources to help them achieve and sustain long-term recovery. Sorry for my voice. It's allergy season. I'm not going to read this report, but there's some things about the operating model that I think it's important that we reiterate and for the public to understand. What we're looking at is co-located services, kind of a little bit of a one-stop shop, co-located services for people suffering from substance use disorder, either in a building or on a campus. We're leaning towards the campus approach, and we can talk about that in a little bit. There will be multiple pathways to enter services, and the important thing is this recovery center is part of a larger system. I know that you've asked before, and other people have talked about, well, what does this mean for crisis stabilization? What does this mean for the clinic that you're acquiring? What does this mean for the other services? It means connectivity, and it means being really clear about what that connectivity is, not just for people inside the circle, but for John Q. and Mary Q. public who need these services. Who do I call? Which one do I go to? So part of this whole initiative, this whole effort, is educational, so that people who are in services, people who need services, know what's out there and know where to go, and that these services are connected to each other. We see a lot of interplay between crisis stabilization and also the recovery center, the navigation center that's being developed in Oregon City. We're seeing people coming back and forth to those. One of the important things for us also will be developing an information system where we can share data. Right now, what you see out across the state really is providers who have really made a good faith effort to develop information systems that they need, but they don't talk to each other. And so I have some information, Mary may have the same information about somebody, we may or may not be able to share that information. So at least with crisis stabilization and this recovery center, we're looking at shared information systems that we'll be able to do that. Services will be delivered by provider agencies. The county will not be delivering the services. The county's role will be funding the initial construction costs, the one-time costs associated with developing the center. But operating the center, the money for the operating the center will come through the coordinated care organizations for those individuals who receive Medicaid, and for those individuals who are not eligible for Medicaid, Mary has some funding for those folks as well. So we're not going to be, and those contracts will be either with the CCOs or with Clackamas County for people who don't have any insurance. So one of the really key pieces is that peers, people with lived experience, will be involved from inception all the way through the journey with those individuals and their families to help them return to the community. We're looking at strong partnerships with public safety and medical providers. We want people not to be inappropriately placed in jail or inappropriately placed in emergency rooms. And so this recovery center is really a resource for EMS, for hospitals, for public safety to be able to have a place, an appropriate place for people to be. We're also looking at what's called the hub and spoke model. We can't replicate this level of service at every location across the county, but we do have rural areas that have needs. We do have marginalized populations that have needs. And so what we're looking at is this center will be the hub, and we'll put spokes out to serve those communities as opposed to establishing full-bore physical spaces across the county. And finally, we're looking at a phased approach. We're not going to get all this done at once. Not going to happen. But we do believe there's an opportunity to phase in the services, to phase in the physical structures, and so that we can make sure we can learn from what we're doing and make sure that we're using your money, the money wisely. Do you want me to, if you have questions, do you want to hold them?
You have given us a lot, and regarding this presentation, that's 30 pages. I do have a couple questions. Commissioners, you want to ask questions of Cindy now? Yeah, I think you might want. And this is a comprehensive report, and it's great. Is it important, or have we been able to identify a certain population that will go into this long-term recovery center?
The initial, Chair, the initial population that we've identified are adult men and women.
Adults, men and women.
Mm-hmm.
Is there an age of the adults?
It would be over 18.
What?
Over 18.
Oh,
18.
well, that's adult,
Yes.
I know that, but is there, I guess what I'm looking for, the nugget I'm trying to find, is there a certain age of population that has more addictive behaviors and addiction than the other population do? We don't know that?
So one of the things that we're doing is we're working with HealthShare to get county-specific data. They have a trove of information, and they're developing this dashboard so we can really dive into the HealthShare members. And look, we have some information about their age, their gender, but we really want to dig deep into that, so we will.
So this will be men and women, adults. Okay.
Could I just add, though, a clarification? With the CCO data, these are individuals, at least within the last year, who have touched the behavioral health or medical system and have a substance use diagnosis. Those are the people who are trying to get services. I think, to your point, Chair Smith, what we are going to have to better understand are the folks who are either not accessing, or really it's such an underreported need.
I see.
So I think we're going to have to build on what we know today once we get that data, and then really begin to understand, are there other communities or populations that are not accessing, and do in-reach into those populations.
And that's really good you made that clarification, because I think that's what this board is trying to understand. Where is the need? Obviously, there is the problem. We have identified the problem. And then how do we serve it, and how do we solve it? Thank you. Commissioner Savas?
Yeah, I just want to say that, I think we've given staff last year, in particular, a charge to put everything together that Cindy basically mentioned here. This data informs that, but there's a word that Cindy used that I want to capitalize on here and make my point, is that this is complex, and we need a lot of different funding from a lot of different places to make this happen. And the people that you're asking the questions about, the age or the vocation, or maybe are they houseless? Are they housed? Are they students? Whatever it may be, knowing the people we're trying to serve is a critical element of that. But this is really a system, and I want to just talk about systems. Systems, I guess because our ranking not Clackamas's ranking, but Oregon's ranking in the country, certainly we've lost a lot of infrastructure and people are part of the solution as well, because without people, you don't have the offices or the services, so we need all of that. And I think our task or our charge to staff was go figure this out, essentially. And we're putting together experts. Cindy, you've done that. Staff's done that. Appreciate that. And learn from the best and try to put this together. And you've touched on that. We've had our updates. I appreciate that. I don't really have a question here, other than I think that we need to be, it's responsible to ask questions for us, but I want to make sure that we are here to help. And so if you have an ask or a request from us, that we ought to be supportive of that, knowing the charge is pretty clear. How do we stand this up? How do we put together a system? How do we fund it? And get all those components together. And maybe a visual might be, at some point, a tool that we can use not just for ourselves, but for the public to know that, we are really being sophisticated about our approach here. And just last week, people just rushed to me. Oh, we have this piece of land. It'll solve your recovery problems. Or we have this building. It'll solve your recovery. It's bigger than that. It's not about the dirt. It's not about the building. It's about all of it and the people. And I know the state's aware of this. Just on the mental health issue, several years ago, there was 500 in the meeting I sat in, state meeting, there's a shortage, vacancy of 553 positions in the state of Oregon. Now, that's not a problem that we can fix, right? That's a problem that it takes the education system, it takes a number of things, levers to pull in order to, and we have all these laws. How do we pay people the commensurate pay for their education to make them stay in this industry? I suffered with that in my completely different industry, but I suffered that from the day I went into business to the day I left. I never had enough people, and I never had the right people. Because the education system wasn't there, even though I paid well. But these are it's complex. And I just want to make sure that you're aware that I'm ready to help and help my colleagues help you fulfill, or whatever it is, the request it takes to make this happen. So I just want to express my gratitude and offer of help.
Thank you. One of the things I think that's important that we're doing that I don't see happening a lot of other places is we're not just treating this in a reactive way. We're not just treating this in an episodic way, one and done. Well, you've had your 6 weeks of outpatient treatment, see you, bye, good luck, hope you don't relapse. We're really looking at a system. We're looking at how people enter the system, what happens to them, what kind of recovery journey are they having, what kind of skills are we helping them, how are we working with families, how are we working with communities, and when they go back into the community, what kind of support do we give them so, in fact, they can nurture and thrive. That's what's different around the direction that you have given and what you have asked. It's not just a one-and-done model. It really is a systems approach, and there's a longer-term approach, understanding that people with addictions, particularly with the level of addiction and the fentanyl and the drugs, it's not your, not your father's drugs, whatever that commercial was, but really taking a different approach and a different expectation, which I really want to congratulate you about.
Finish, Commissioner Savas?
Oh, yes.
Yes, Commissioner Scholl, you're up.
Thank you, and good morning. It's important that we get a kind of a feel for the scale of this project. We have spoken before about the need to identify how many people in Clackamas County or the area do we have today who could take advantage of such a facility. We don't want to overbuild this. We want it sized for efficiency and for efficiency of operation. So these things need to be looked at before we can proceed on the design of this thing, this project. And since we're about, at best, 2 to 3 years out before we can turn the key in the front door, it's important for us to look at how we're going to, not how we are going to bring on the personnel to run the operation, but we can begin to work on, like Commissioner Savas said, encouraging people to begin to train for mental health jobs to make this project successful. So I'm excited about it, and good luck, and thank you for your work.
Thank you.
Thank you, Commissioner. Commissioner West, you're up.
I'm super excited about this.
I hope so.
I'm really jazzed. Listen, this is the reason why I became a nurse, and this is the type of stuff that gets me excited to do public service and health policy work on a local level. Yesterday, I made an analogy about problems and a metaphor using potholes, and potholes are different sizes. Some problems are bigger than others. Our country's in crisis. It's a fentanyl crisis. It's an epidemic. In Oregon, with Measure 110, instead of doing its job that it had abdicated election cycle after election cycle, it decided to turn on the faucets and make us a very welcoming, permissive community to elicit drug use. Now, some of that was because they wanted to deal with disparities and not have people, languishing in a legal system or in the justice system or in our emergency rooms. But we never had the infrastructure or an established care continuum to get people the humane and ethical treatment that a patient deserves. If somebody is in recovery and they struggle with substance abuse and they want treatment, they deserve treatment and the right to have it. You have a couple of really great slides in here that we've talked about a couple times. A wake-up call. Your data is fantastic here. It comes from the National Survey on Drug Use and Health. It was conducted by the federal government, the Substance Abuse and Mental Health Service Administration. And it talks about the percentage of change recently in Oregon and its increase in its opioid crisis and how we have seen it exacerbated in a very alarming rate. The percentage change in Oregon is 34.15%, astronomical. Oregon now ranks second in the country for substance abuse disorders. Oregon ranks first in prescription opioid use, and Oregon ranks first in methamphetamine use. We also have some of the highest increase in opioid-related deaths and overdoses. That's not in here. We have been spotlighted across the world in the media about the crisis which we face. I used to love a baseball movie called Field of Dreams, and there's a classic line in there that says, "You build it, they will come." Well, we built a permissive drug culture in Oregon, and we got it. We built it, and we allowed it. This, though, is starting to fill a really big pothole, like big problems, little problems. And this resource has been needed far before Measure 110. We always had the sin taxes. We always had marijuana and alcohol taxes, and we could have allocated those funds to the legislature. They could have directed things. They could have helped us at a local level deal with something that was already beginning a problem far before the voters passed Measure 110 and now have some buyer's remorse. But they didn't. But here we are in Clackamas County at a local level seeing a big pothole. At the end of the day, we got to fill a pothole. So I'm really proud of this work. It's no small feat, like what we're doing. When you mentioned the quote, "pockets of excellence," and that just rings so true to me. I've had legislators, people in industry, people from across the country, people from other nations say, "How is this happening in the Portland area? What is beginning to shine and ring true in your local area within the Portland metro area that is not being seen anywhere else? You guys are like surrounded in dysfunction and in crisis and epidemic, but there's these little pockets of excellence, and Clackamas County is that." This last year, over and over again, even against opposition, we've shown excellence in many of our outcomes. The data is the data, the evidence demands the verdict, and Clackamas County has been excellent. I'm excited about how we get to creatively and innovatively build out a care continuum that fills the gaps that have I believe, immorally not been filled up to this point in the state of Oregon and up and down the West Coast. So I'm excited by that. I also want to take just a second to thank my colleagues here on the dais, because this is a big deal. This is real leadership. That right along with you, Paul, will forever be ingrained as a big moment where seeds were planted for a big dream. I traveled across this country with Commissioner Schrader and was inspired by New Haven for Hope and their campus that's wildly successful in San Antonio, met with their commissioners, worked with NACO. We just got back from DC, where we started to advocate for additional few $1 million from our bipartisan support from the legislators in the Senate here in Oregon and in the House. Commissioner Scholl, your steadfast principles in trying to help figure out solutions to this issue while also bringing accountability, and Chair Smith, your leadership as the chair to work with the rest of the counties and to lead us and to help encourage us to take on big problems. I really appreciate it. And I think that this is noble and good work, and I'm super excited by it. And so this is the only thing I accomplish in 4 years. I will leave this office as an incredibly happy man. I think we're starting to walk down a path that's going to be replicatable and should be allotted. So thank you for this, and I'm excited to see what this looks like. And hopefully here we'll make a motion and we'll be able to get you some additional authority to move forward with this project. Thank you.
Commissioner Schrader.
I just want to thank both of you for all your hard work. One of the reasons I'd like to be back on this commission, I'd like to see this particular project brought to fruition, because I think it's critically important. But I have a question for you. So I've been reading about coordinated CCOs, coordinated care organizations. How does this, for the public, how does this fit into this entire system? They'll be a big, huge partner in this, will they not?
Coordinated care organizations were established, 10 years ago? 10 years ago. And basically, the state, the Medicaid money flows from the state to coordinated care organizations. And they, in turn, particularly for behavioral health services, where we used to contract for those services, now the coordinated care organizations contract for those services. And so they will hold the contracts for the substance use for anyone who's Medicaid eligible. We have 2 coordinated care organizations in our region, HealthShare of Oregon and Trillium. HealthShare has the vast majority of members. And so they will be, we're going to be working with them, and we actually have a meeting today?
Next Wednesday.
To talk with them about this. We have been, as I said, meeting with various groups. We were invited to meet with the EMS Council next week. They're really excited about this, to hear about it. So as the word is getting out, we're getting information out to folks.
And just to share some of the data you put in this is a great presentation, by the way. Here it tells us we have 4,500 members have substance abuse disorders diagnosis and receive one or more services. Another 30%, 1,300 members have an SUD diagnosis but have not received services in the past 12 months. I should know what SUD is, but it's an acronym, so remind me what.
Substance use disorder.
Substance.
We're trying to change the language from addictions to substance use disorder. And that is not just us, that's really kind of across the country. So we're trying not to use that.
Thank you, guys.
Is there anything else you want to do on a presentation today?
Well, the one last thing, I would like your approval for us to issue a NOFO, which is a Notice of Funding Opportunity. This is different than an RFP, Request for Proposal from contractors for services. A NOFO really is the vehicle for us to give providers grants. Supported Housing Services, they use a NOFO to get the dollars out the door to providers. And so what we're going to be doing through the Notice of Financial Opportunity is requesting plans from providers. Here's the data, here's what we know. Based on all this, come and give us plans on what you would do, what kind of services. We'll give them what our expectations are, and then part of it would be that we would grant them dollars for the physical construction of the centers, not for the operations. And so we need, the NOFO is the vehicle for us to do that, so we need your approval to issue that.
So we
Before I go to Commissioner Scholl, okay, thank you. Commissioner Scholl, you're in the queue.
Yes, Mary and Cindy, could you please clarify this next step process? Now, I see in your paperwork all the coordination you're going to do on next step. And then you're going to come back with a proposal to the board for recommendations on the structure, program, and design and funding plan. I don't understand in between there how you go out for a NOFO without first giving us a picture of what that structure, program, design, and kind of parameters of what funding is to be. Could you explain how that's going to work?
Absolutely. And that's actually a really good question, so thank you for that. We really are going to be relying a lot on the people who are boots on the ground. Our providers, our peers, they do these services, whether it's Central City Concern or Cascadia or CODA, all those services. And so we're basically going to say, here's the shell. This is what we're looking for. Here are the outcomes that we want to see. Given that, here's the basics, here's the outcomes, come back and give us a plan. Here's the data, all of that. In the meantime, as I mentioned, we're doing things on parallel tracks because we're also meeting with potential funders. And so when we talk about the funding available, we'll give a range of funding. We're not going to say we're going to give you, $11.2 million. We're going to be talking about a range of funding. The more important piece is to get the plans and hear from our providers as to what they can accomplish. We already have the data in terms of what people feel we need, whether it's detox or outpatient or employment services or transitional housing. There's a whole array. So we've got the ingredients, and we're going to be asking the provider community to come back and say, okay, given all that, what are you going to propose?
Yeah, okay. So you're going to get the input from the NOFO request. You're going to look at that. We're going to be able to see what that is. And then you're going to finally come back with that recommendation for structure, program, design, and funding. And about when do you think that'll happen?
I can't give you a date because to be honest with you, but it'll be over a few months by the time we finish writing the specs,
Okay.
and then we give it out to the provider community and get it back. We're looking at several months.
Okay, thank you.
Commissioner Savas?
Yeah, I just want to know how to frame the motion.
Gary, you have an idea how to frame the motion?
That you authorize staff to move forward on a notice of funding opportunity.
So moved.
Second.
Commissioner Savas has moved that we instruct staff to go forward with a notice of funding opportunity for
Recovery Center.
the
Clackamas
Recovery-Oriented Service Center. There, I wanted to get the exact, thank you. And Commissioner Schrader has seconded the motion. Further discussion? Well, I'm very excited. We all are. Thank you very much.
Thank you.
Clerk, please take the poll.
Commissioner Schull,
Aye.
Commissioner West,
Aye.
Commissioner Schrader,
Aye.
Commissioner Savas,
Aye.
Chair Smith.
Aye, motion passes 5-0. Thank you very much. Go forward and do wonderful work.
Thank you.
Everything will come back to you for no final decisions without your briefing and then action.
Sure. Anything else, Gary?
That is all the sessions for today, Chair.
See no further business before this commission. We are adjourned.